babies can be born with tear ducts that aren't functioning quite yet. A baby doesn't start to produce tears until approximately 4 weeks of life. And at that time, the tears may not have a spot to drain because the tear duct may not be open quite yet. We wait approximately 1 year for tear ducts to open if a baby's eye is just tearing. If it's real goopy and there's a lot of discharge, we may consider opening it earlier than a year of age. The best thing to do if you have a child with a watery eye is to massage the tear drain. And it has to be fairly aggressive massage, but you can place a finger right in the inner corner of the eyelid. You may feel a little ridge in your own tear drain, and you can massage that ridge to try and improve the watering and open the tear duct naturally. Now, if the tear duct doesn't open by a year of life, or if the eye is real goopy and very irritated and the infant is having episodes of multiple infections, then we may need to consider surgery earlier. The procedure that we typically do is a tear duct probe, where we place the child to sleep. We place a probe through the tear duct and probe into the nose. I oftentimes will use an endoscope or a scope in the operating room to allow me to watch that probe enter the nose where that tear duct should exit. Oftentimes, through the tear drain, we place a silicone stent that bridges the upper and lower lid and is tied in the nose, and we leave that stent in place for approximately 6 months. Now, depending upon the age of the child, we may be able to remove that stent in the clinic in a quick procedure where I engage the stent, pull the stent, and remove it. If the child is slightly older or even toddler age, where we're not going to be able to hold them in a safe manner, we may decide to give them a little laughing gas or put them to sleep in the operating room to remove the stent.